The heart is a muscular organ in humans. It pumps blood through the body's blood vessels. This blood carries vital oxygen and nutrients. It is roughly the size of a closed. It is located in the chest between the lungs.
From a simple cluster of life-giving cells, the primitive heart tube begins to fold, looping and expanding into 4 chambers.
2 endocardial tubes merge to form the tubular heart. It elongates and loops, showing the first asymmetry. The tube differentiates into distinct form within to separate the left and right sides.
Heart cells derive from the mesoderm. Induction occurs via WNT inhibitors like DKK1. Mesothelium forms the outer This includes lymphatic and blood vessels.
In the cardiogenic region, endocardial tubes develop. Embryonic folding pushes the tubes into the thoracic cavity. They fuse to form a single tubular heart. At 18 days, the heart begins to form. 2 endocardial tubes develop. They fuse in the truncus to the sinus venosus. Contractions propel blood from tail to head.
The truncus arteriosus divides to form the aorta. The bulbus cordis, cephalic folds push the heart in the chest. The horseshoed area expands to form the ventricles.
The heart tube receives venous drainage and pumps blood to the dorsal aorta. The dorsal mesoderm disappears to form the heart wall forms from the endocardium, myocardium, and epicardium.
By day 23, cardiac looping begins. The atrial portion moves to the left. This conduit connects the common atrium and ventricle. The arterial bulb forms the right ventricle. The tube is divided into cardiac regions. The primitive left and right ventricle. According to this axial twist theory, this is due to a twist in the body.
In the middle of the 4th week, the sinus venosus receives venous blood. The sinus opening moves clockwise. In the 10th week, the coronary sinus remains. The right pole joins the right atrium. Valves form the septum spurium. The upper right venous valve disappears. The main walls form between day 27 and 37, endocs to split the canal. At the end of week 4, the septum primum grows.
The ostium primum forms between the septum primum and cushions. Endocardial pads grow to close this opening. Riemann ovale creates a long oblique slit for blood flow. A pulmonary vein develops as a bulge in the back wall. The vein and branches are incorporated into the left atrium. 2 atrioventricular The canal gives access to the left ventricle.
Blood accesses both primitive ventricles. Cushions merge, forming right and left orifices. The intraventricular foramen disappears, achieved by further growth.
The arterial cone is closed by infundibular cushions. The aorta is left and dorsal, pushed forward to the right. The pulmonary artery is right and ventral.
Myogenic waves begin spontaneously in the heart muscle. The pacemaker initiates this activity with a faster depolarization time.
The ventricle is the first pacemaker, but these cells derive from the right venous sinus, forming an ovoid. Then the atrioventricular node forms, sending branches to the right and left ventricle. Most derive from mesoderm.
At 5 weeks, the embryonic heart begins its first rhythmic beats. The spontaneous electrical impulse spreads through a specialized conduction pathway. The human heart begins beating at roughly 80 beats per minute. It accelerates by 10 beats every 3 days. It decelerates to about 100 and 145 at term.
It starts at the SA node, causing the atria to contract. The signal travels to the AV node. Purkinje fibers trigger the pump. The human cardiac cycle begins. Blood fills the atria and flows to the ventricles. Then, the powerful ventricles contract, pumping blood out. Finally, the heart relaxes, preparing for the next beat. Deoxygenated blood enters the right atrium. It is pumped to the lungs for oxygen. Oxygen-rich blood returns to the left atrium. Then, the powerful left ventricle pumps it out to the body. Cardiomyopathy is a primary disease of the heart muscle. It causes shortness of breath, fatigue, and can lead to heart failure. Ischemia is a restriction in blood supply to tissues, causing a severe shortage of oxygen.
Angina is chest pain from reduced blood flow. It's a warning sign of heart disease. A heart attack is a sudden blockage. Call emergency services immediately.
Coronary circulation supplies the heart. Arteries deliver oxygenated blood. Veins drain the deoxygenated blood away. Interruptions quickly cause heart attacks. Ischemia, caused by obstruction, leads to infarction. Spindle-shaped fibroblasts respond to the injury. They synthesize collagen to repair. This creates a structural scar. Following heart injury, fibroblasts activate. They become contractile myofibroblasts, repairing the tissue. They also couple electrically with cardiomyotes, confirmed by optogenics. Fibroblasts insulate the heart's conduction system. They can transform into beating cardomyonates. Gap junctions bridge a 2 to 4 nanometer gap, allowing direct exchange of.
An arrhythmia is an irregular heartbeat. It can be too fast, which is tachycardia, or it can be too slow, called bradycardia. Some may have no symptoms at all.
The cardiac cycle sustains life. During atrial systole, the upper chambers contract. Ventricular systole acts as a powerful pulse generator. This propels blood throughout the entire body. Electrical systole is the spark. Mechanical systole is the pump. Together, they drive your heartbeat.